NHS, save our NHS.
We were forced into this position.
They haven't listened when we've said that this contract will be unsafe for our patients.
At hospitals in every corner of England, you couldn't mistake the symptoms. Anger and frustration, pushing even doctors who thought they couldn't do it to man picket lines instead of the wards.
We make difficult decisions every day, but this is the most difficult decision I've ever had to make in my 3 years so far as a doctor.
All right, just mind yourself getting up that curve. Yes.
Patricia Thompson was a full-time nurse for 41 years. Arriving at Worthing Hospital, she wasn't sure she'd get her cataract operation, but she had no doubt who was to blame.
It was a privilege, we were taught, to look after patients. What on earth are the professionals doing? I think it's disgraceful.
But others directed their anger at the government, like Michelle Judrill, who should be recovering from a hysterectomy in hospital.
And they just rang and told me it was cancelled and it's up to a 3-month wait to get booked back in.
How did you feel at that moment?
Devastated, to be honest. Really, really upset over it.
Inside many hospitals, consultants stepped in to cover their missing colleagues.
What's things been for you? I had a little bit of trouble with my leg in the night.
And they did so willingly.
I think it's important that we keep patients safe, but it's also important that we keep our staff safe, and it's important that we value our staff and that their morale is high.
We need one to go home now, but
it hasn't been easy. This was one discharge team battling to get patients home so more could be admitted. But in Samwell, in the West Midlands, one hospital said its juniors had to come back because they couldn't cope with demand. Some said no, claiming they'd only agreed to come back in a real emergency.
They sent an email out at 8:15 this morning asking us to come back in, not telephoning us like they said they would. At the moment, the clinical incident is an internal capacity issue because we've got too many patients that we need to discharge.
Were both sides playing politics? The Health Secretary insists it's simple.
We want a safe NHS.
We want a safe NHS, he said, before adding to the pressure on striking doctors.
It's not acceptable to have mortality rates at the weekend that are 11 to 15% higher, and we want the NHS to offer the safest and best care in the world. And we all have that in common. So the right thing to do is to talk, not do what we're seeing today, which is put patients at risk.
He wants to reclassify Saturdays as part of junior doctors' normal working week. The money they'd lose in additional payments, in theory, offset by a rise in basic pay.
But right at the heart of this row is the belief shared by many staff that they're being pushed to the limit in a, quite frankly, cash-strapped NHS because there just isn't the money to pay for a full 7-day service.
The government insists it is affordable, but what little trust there was between the two sides seems broken, and with 2 more strikes looming, time is running out to recover it. Rachel Younger, News at 10, Milton Keynes.